kind of hypothetically here, just for a minute, if the data from the randomized study were to demonstrate a benefit relative to standard of care, and something like this became available, assuming it was approved by the FDA, how would you incorporate this into your treatment protocol for Lee's? Is this something that's appropriate for all patients if it were approved? Is it something that you reserve?
I think so. Right, absolutely. And I think that they demonstrated no significant side effects with it. So definitely, we always are looking for new approaches. It is my impression that in Europe it's more available because we've seen patients from Europe who've been using that. I don't know how they got it, but as usual in the United States, it's behind. So again, I don't know what the status in Europe is, but yes, we will definitely, if there is the proof that it's useful, we'll definitely start incorporating it in treatment.
Okay, I want to switch gears a little bit. As I mentioned on the beginning of the call, this company isn't developing it only for Leigh syndrome. They're developing it for other mitochondrial disorders as well. And I wanted to see if you had any perspective on the potential or the likelihood of a benefit in other indications that they're looking at, and how much can we, I'd say, read through the clinical data that are currently available to other disorders. The one of particular interest is PCH6, and the clinical data that are publicly available are shown on slide 3. And PCH6,
now, could you please tell me why is it so, because it's a very, very rare disorder, right? I mean, it's just like few cases reported. I looked at OMIM yesterday. It belongs to the group of this aminosyltieranase synthase deficiencies, and this is RARS2. They're also not exactly the same clinically, but with the same mechanism. DARS2 far more common, YARS2 more common. I have patients with ERS2, but RARS2, my understanding, is one of the most rare conditions, like really rare. So I just was curious why this one in particular.
So I can't speak to the total rationale of the company, but what I can tell you is what my understanding is that they were evaluating it across a broad range, almost in an all-comers type of study through sort of a compassionate use program. And I think this is one that they identified a patient who was having a benefit, and so they expanded it to other patients. But you're correct. Our understanding is that it's extremely rare as well. The thought, though, or I think the hope is that based on the benefit they've seen in this particular mitochondrial disorder, that there is enough of a common pathophysiology across these diseases that it could potentially have use in other mitochondrial disorders that result in drug-resistant seizures or mitochondrial epilepsy. And I think if you were to look at these data, and this is all conceptual at this point, right? But if you look at these data in PCH6, would you? Is there enough here to give you confidence or at least hope that it may work in a broader group of diseases, regardless of genetic defect or regardless of gene that is defective in the mitochondrial disorder? You just rattled off 2 or 3 that are more common. Would you think if it works here in PCH6, it might work there as well?
Yeah, I think, for mitochondrial disorders generally, they're common. If you think about pathway, in many of them, it's just not enough production of ATP, and it's independent frequently of what the mutation is. Again, with this PCH6, they all have pontocerebellar hypoplasia. You cannot reverse that. But, they prove really that this compound works for seizures, and yes, of course, it might work for you would speculate that it would work for other patients with mitochondrial disorders, for seizures and so on. There are some of them, like MERS, for example, where seizures is like a presenting feature, not like Leigh disease, for example. They do have seizures, but it's not a very common feature for these kids, although some of them have bad seizures. But there are some mitochondrial disorders where seizures is really like presenting